IntriHEALTH CEO Mike Simpson joins us now to talk about the phased-in approach of this scheme and how the private sector can work hand in hand with the state to achieve this. Mike, good to have you, and thank you very much for coming on this evening. Although we are speaking now of the NHI being implemented as in the various two phases, beginning now in at least 2023 up until 2026, there has been some pilot phases that would have started back in 2012 up until this point, where the whole approach has been around strengthening of the health system, or what they call HSS, health system strengthening, not necessarily seeing the NHI itself being implemented. Talk to me about those processes and how that was able to at least deal with the barriers that were there as far as health system performance is concerned.
Thank you very much. We weren't directly involved with that, but our approach is that NHI is happening, and it's about the infrastructure. It's really about getting the infrastructure out to the rural people and through the use of technology. We don't believe that NHI will be efficiently run if they don't incorporate the latest technologies and working with the people in the communities. That's the biggest drive. These pilot projects have worked. Some have been successful to the best of my knowledge. Some haven't been, but there's a need. There's a need to really just be practical and align ourselves with the United Nations, with care to the people. And that's where we've been focusing on rolling out clinics, utilizing technology, and even the incorporation in some instances of artificial intelligence.
Yeah, something like one of the pilot programs would have looked at a very intensive integrated school health program where some 4.3 million learners would have been screened and some 500,000 referred to for treatment. I mean, how would you use technology, especially to enhance that part of the NHI program?
I think prevention. I really believe that the future of healthcare lies in the prevention. It's too late once you've got diabetes, but through screening mechanisms throughout the different sectors, one can pick up variances, and once these variances are picked up, the respective people can be put on a path of care. The biggest problem is, I'm sick, it's too late. I've got cancer, it's too late. But if we catch it at the early stages, and this is through prevention, screening, monitoring of the population, be it at home, be it at clinics, be it at schools, be it at university, be it in the office, I believe this will be a great contribution to the well-being of all people.
Yeah. So some of the systems that you have proactively developed in the process to ensure the effective functioning and the administration of the NHI program?
The telemedicine. You know, we've got doctors, and we focus heavily on the rural areas, and a doctor, a specialist, they've studied hard, they've worked hard. They don't wish to be in the very outlying areas. So it's only through the telemedicine solutions whereby we enable the nurses to do the vitals, take the questionnaires of these people in the rural communities, put that onto a centralized database, and then consult with the doctors remotely. We believe that is going to be a big play in bringing healthcare to all the people, not just the people that are living in the urban areas.
Yeah. An electronic system called Sync was introduced in the pilot phases. It's some kind of an electronic prescription system that will ensure that, for example, stocks are well monitored and the database of patients is also well kept. Is something like that a system that can be integrated, for example, into your system and other private sector systems so that they speak to one another?
Very much so. I think it's all about integration. The whole world's gone that way. Systems have to talk, and they can talk through various communication layers. It's essential. The biggest problem is double subscription. A person gets a script from, let's say, a government institution, and then from a private institution, they get the same script. That's wrong. That's a cost, that's unnecessary cost to the health NHI. So integration is key for the success of the project.
Yeah. How do you read the attitudes of the doomsayers? I mean, is this something that is profit really driven, those who are denouncing the NHI?
It's certainly commercially driven. I'm sure that there's valid arguments, but we always just bring it back to what we've got. 16% of the population that are on medical aids, but what about the rest? How can we bring healthcare to them? I think, they're threatened. Change, people don't like change, but we have to think broader than ourselves. I think we have to think about our fellow brothers and sisters and how we can uplift the whole country and make it a great place.
And is that something that you see happening at least in the next 5 years of the implementation of this NHI, if it's properly implemented like it should be?
I think it will take a bit longer than the 5 years, but I think there's going to be strategic steps made. I think over the next 5 to 10 years, we'll definitely see major contributions being made. I think the big emphasis has to be on infrastructure. While the private sector's healthcare system works, the government healthcare system has really ground to zero. It's a poor environment. There are some great facilities, but at large, the people are battling. If you go to these clinics in these outlying areas, you've got 500, 600 people at these clinics. If the staff arrives, it's great. The level of care is challenging. If they've got medicine, that's challenging. So we have to get back to basics. We have to look at the infrastructures. We have to say, can we service these people and how best to service these people? And people need to be held accountable.
Yeah. You are more inclined towards a problem-solving kind of approach to this. Is the organizational culture, for example, within our clinics and our hospital, inclined towards that? I mean, is it overly bureaucratic, or is it supportive to a problem-solving kind of stance that you're taking?
I think it's bureaucratic. I think we need systems. Systems can monitor. It's like if you go to a hospital, a government hospital, they open up a file, and if you come back the following day, the file's gone. If a person's transferred from one ward to another, sometimes the file is missing. So it's systems. If we implement the right systems, accountability comes about, efficiency comes about. Those are the things. But I think systems will go a long way to bring about an improved healthcare solution. But we have to have a will. If you go into the medical profession, look after it. You've joined the medical profession to take care of people. Make that an emphasis.
Indeed. Mike, we appreciate your time. Thanks so much for coming on. Mike is the CEO of IntriHEALTH. Mike Simpson saying the challenges of healthcare in the country can certainly be met if we work towards the objective being to actually service the people, and certainly the private sector can come on board in improving the healthcare system in the country with the NHI in place. That's Mike Simpson there, right?